Okay, for our next social institution, we're going to be looking at the social institution of health and medicine. There's a whole field of medical sociology that examines these kinds of issues. One example of applied sociologists today is during the current pandemic, there are a lot of epidemiologists or people who study outbreaks. Part of what they do is study social networks, which we saw in our last discussion of social network tracing, looking at how wealthy people share social networks. We can also look at how healthy and sick people share social networks. Health is indeed very much about, as we're finding out today, about um, where we live and what part of society we are in. Now, thinking about health as a sociological issue can be tricky. We often think of health as something that's simply about biology, as what's wrong or right in your system, as something functioning properly or something dysfunctioning or something maybe affecting your body in some way. Um, and so we think of health as something as basically biological. But from the sociological perspective, we're interested in a number of things. And in this section, we're going to look at how health is socially constructed. And what that means is, where do we draw the line between something that's healthy and something that is pathological or diseased or not healthy? Pathology meaning something that is dysfunctioning or diseased. For example, many of us right now are probably anxious about where the world is going. But how much anxiety is too much? When does that anxiety become a disorder? When does it become a medical problem? How much weight is too much? What is a healthy weight? What is too much? When is pathological weight? When does sadness become depression? Pain is a normal part of functioning in everyday life, but when do we as a society say pain is too much? Up until a few decades ago, most people didn't even go to the doctor for pain. There was a whole sort of revolution where doctors tried to get people to start treating pain as more abnormal, and they came up with something like this 10-point scale um, to try to get people to uh, understand where their pain levels were and be able to communicate about pain, because for so long we didn't have a language about it. Or look at the chart on the left here. Depending on your height and your weight, you could fall into the green or the yellow or the red zone. You could be dangerously overweight. Who decides what's risky and what isn't? Is it just a question of biology? Or is it a question of society? So how do we decide this? Who gets to decide? The whole point here is that what's healthy and what isn't just about biology. It's a social construct. Um, it has to do with our values and beliefs in society. For example, looking at the systolic pressure, um, from 2017 to 2018, the level at which we call high blood pressure was lowered. And what that means is that from 2017 to 2018, a whole group of people who had a certain blood pressure, who would have been pre-high blood pressure but okay, are now in high blood pressure territory. All of a sudden, millions of people are sick as opposed to healthy, even though nothing's really changed about what they do and how they feel. So how we decide what's healthy behavior and what's sick behavior really depends on society. Often key institutions, and this is one of the key functions of the medical institution, is to tell us what's good and what's bad. Needless to say, this is not necessarily something that is without power relationships involved. For a long time, homosexuality was classified as disease and seen as pathological or unhealthy. Today, most doctors don't agree with that and have taken it off of the psychological disorders book. But today, things like excessive anxiety is a disorder. Or the fact that as the male body ages, its testosterone levels naturally tend to decline. But today we call that a medical issue, low testosterone, and we treat it with medicine. So why and how does this change is one of the key questions we want to think about sociologically, and we're going to be grappling with in the next few videos.